I'm delighted to be joined today by Dr. Jayne Chidgey-Clark, who is the National Guardian, and she will explain exactly what that means. Welcome, Jayne.
Thank you, Linda, and thank you for asking me on to your podcast. I've listened to quite a few of your podcasts with real interest, so it was a real privilege when you asked me to join you. So yes, I'm National Guardian for Freedom to Speak Up in the NHS in England. That's my job title. So I've been there for 2.5 years, which is a lead national role supporting freedom to speak up in NHS organisations. So some of your listeners will remember far too well the Sir Robert Francis inquiry into the care failings in mid-staffs. And following that, he did a review into speaking up in the NHS, and he recommended that there was a national office set up to lead, train and support a network of people in a role called Freedom to Speak Up Guardians, who will help workers across organisations be able to raise matters of concern in a confidential and safe, supported way if they feel they can't raise them with, the usual routes. And it was introduced as like a safety valve, because what Sir Robert found in the inquiry was that workers knew that things weren't right, but they weren't speaking up about it because they were afraid of retribution, losing their jobs, sticking their heads above the parapet, etc. And they were also afraid of, well, what's the point, because nothing's been done so far and we've said things in the past. So that's sort of fear and futility ring. So that's our office was set up to lead, train and support a network of people doing that, and also to carry out reviews into speaking up, whereby to add learning back into the system as to what helps make a good culture. So very much ties in with the leadership things that I think we're going to be discussing today. So that's me.
Absolutely fascinating role, I'm sure. So what we like to start off with normally is asking the people who join us on these podcasts to tell us a little bit about their career pathway. What got you to where you currently are?
That's a good question, and it's really interesting, isn't it, when you listen to different people's career pathways. Some is quite obvious and a quite traditional route to a leadership position. Mine's not one of those. I started out life as a nurse. I qualified as a nurse way back in the eons of time in 1988. And we used to work clinically first off in acute medicine and then in end-of-life care. Cancer and palliative care was my passion. That's my clinical specialty, and I was also absolutely clear that I wanted to be using the best available evidence to carry out the best care possible whatever team I worked. So I had the privilege of going to St Christopher's Hospice and getting a training in end-of-life care specialism with Cicely Saunders, because she was still working partly then, and some many other amazing individuals. And I got really interested in a particular area of end-of-life care around outcome measures in end-of-life care, and I decided to apply for a studentship for a PhD back in those days. The department did like 3 studentships a year, and I got one of those. So I was really interested in trying to combine a sort of an academic background to my clinical practice, and obviously for other people's clinical practice as well. So I did my PhD, and alongside doing my PhD, I was a lecturer practitioner, I was a research practitioner, so I was combining those clinical roles with the academic side. And then I eventually went into higher academia, and I thought that's probably where my career path was going to take me, because I loved that evidence base behind what we're doing and carrying out the research, and helping people improve their practice. However, and the however is, for me, after a while in full-time academia, I was like, nah, I'm too far removed from practice and from people in that way. So I came back into practice. I thought, well, I'll use those research skills in whatever I do next, but I don't want to stay in full-time academia and become a professor, which was my sort of, I guess, the career path I could have taken back then. So I took my learning from my PhD and from all the work that I did, and then had other leadership opportunities emerged. I was one of the first nurse network directors for cancer networks when they were set up way back. Some of your listeners may remember those times. Then I went to be a director of nursing in a PCT, and had that sort of commissioning experience. And then I can't remember exactly off the top of my head the different routes, but it's a little bit eclectic, because opportunities came and they interested me, and I thought my skill set can help. It'll make my skill set bigger, but at the same time, hopefully I can help whatever that role is. So I worked for NICE, which was all around implementing NICE guidelines. I was one of their implementation consultants. I went and worked with the new care models team as part of NHS England. We're looking at improving, better ways of delivering care. Back in the day when the new care models was going, I was missing my clinical practice in end of life care. So for a while, I went back into that and worked within Marie Curie and Macmillan, and so it's been quite eclectic, I think is very fair to say. And then as I became more experienced, for 5.5 years, I was a non-exec director in a clinical commissioning group in a CCG, which was invaluable experience as the nurse on the governing body, very much dealing with safeguarding and quality and those issues, but contributing to the wider leadership team in terms of managing those organisations and the quality of the services they commission. And that was a really fascinating time. And then, in terms of did I aspire as Jayne back in 1984 to be the National Guardian for Freedom to Speak Up? Well, no, because a role like that never existed. But I'm actually the second National Guardian. So Dr. Henrietta Hughes was the first. She was appointed after the Francis Review when the government took that recommendation on. And back in 2021, she'd been in the role for a number of years, and she went on to other things, is now our Patient Safety Commissioner. And the role became vacant. And I remember seeing it advertised, and I've always been passionate about a good culture in organisations I work in. And one of the things that's really important for that is psychological safety and the ability to speak up, both from a patient safety perspective, but really importantly as well, from a worker wellbeing perspective and an innovation. If you've got a great idea for research or improvement, you need to be able to be confident and be safe that you can bring in those ideas. And obviously, particularly if it's matters of concern, patient safety, bullying, harassment, whatever. And I saw the role and I thought, do you know what? I'm going to put my hat in the ring for that, because I would love to make a difference in that space. I had been a Freedom to Speak Up Guardian for a while in the CCG, and I just thought I'd like to see if I've got the skill set that they would want for that role, and indeed they did. So I started in December 2021, and I have another leadership role alongside, which is I'm the independent chair of an adult safeguarding board, which is I'm passionate about safeguarding as well as end-of-life care, and had lots of dealings with that in previous roles. So I took on that actually before I took on the National Guardian role, and obviously it's a very, very part-time role, so I manage the both. That's a bit like my non-exec type portfolio part, but my main role is as Freedom to Speak Up Guardian. So not what you'd call your traditional route. So if that encourages any of your listeners thinking about leadership, I don't think these days it has to be a traditional nurse, ward manager, operational director of nursing. I think, and actually for me, what was really important was to get different experiences elsewhere, and they combined to make me the sort of person I am today, I guess.
And I think it's fascinating that for people to hear the different routes that people take, and how you start off in one direction, and then something where you think you can translate your skills comes along, and it creates a depth and a breadth, doesn't it, of experience. And on our leadership programs that we run, people are often grappling with that, and how to create a leadership style of their own. How would you describe yours?
Oh, that's always $1 million question. I don't think I describe it in any one fixed word. So you look at the literature around leadership, there are lots, transactional leader, autocratic, democratic, situational. I guess probably most apt would be situational, meaning I adapt my leadership style depending on what I'm leading and the unique requirements of leadership at that time. Because for me, leadership isn't just something I put on in the morning when I get dressed and clean my teeth. It's something that I use, it's a tool that I'm using, and it's my leadership skills that I'm bringing. So if I'm in an organisation, let me take my safeguarding role, for example, and that's very much around supporting the member organisations to deliver what they need to deliver, and that assurance piece and the holding to account, that requires a different type of leadership. And sometimes I will have to be quite use that positional power to raise issues, escalate them, etc. But I wouldn't necessarily use that in my team, in my National Guardian role always, because actually giving a compelling vision and supporting an organisational culture, which is one where people can feel included and they've got a voice that matters and they're part of something to deliver their best, demands different skills. So I think probably situational describes it the best, but that is that's not really a particular style. It's a number of types of leadership skills I'll use at different times. And sometimes I'll get that right, and sometimes I won't always get that right. I might use the wrong one at the wrong time because I'm an imperfect being.
Well, aren't we all? But it's what we learn from those moments, isn't it, really? And one of the things, I mean, you kind of touched on it just then, that comes up quite often is how people can become authentic in their leadership. What would you say to somebody who asked you how they could do that?
So for me, integrity and excellence in what I do is a bit of a cornerstone of sort of values for me, and within that wrapped up is authenticity. So it's like bringing your whole self to work, and it takes courage. So I guess the first thing is to find your own courage, because if you're not authentically you, you'll be found out. Now we all get a bit of, I don't know whether you've talked much with other participants in your podcast about imposter syndrome, and I think it's something that we know that women have a lot more of imposter syndrome than men can, and men do, but in terms of the research basis, there's a lot more imposter syndrome in women in leadership roles. And I guess one of the important things when thinking about, or am I being authentic, does this sit comfortably, does this chime with my values? So understand and know your values, and then live true to those, and that authenticity really, really matters, because when people are listening to you, if you're being inauthentic, they will feel it. They'll hear it, but they'll feel it. You just feel that there's something maybe slightly discordant and resonant, and it's about that authentic presentation, including your foibles and potentially your failures. So being authentic is also being able to say, sorry, I got that wrong. And I do. And actually, I've learned from some of my mistakes, as much as we've learned from good things. That's, I think, what we often will do in life, let alone as a leader. But that authenticity, being true to our true north, if you like, and thinking about how you can demonstrate that authenticity in what you're saying, because it's how you make people feel at the end of the day.
Yeah, absolutely. So what would you say were your standout defining moments? Can you recall one or two that really kind of made an impact on you?
I'm smiling because I've been working a very long time, and I feel quite, that's quite a challenge to think of, because there've been so many standout moments. I guess maybe for me, more than moments, because that's like over time, it's the standout people, because that will be a moment with standout people. So for me, if I think back to my early career, some of those standout moments, I still remember the first person I nursed as a newly qualified nurse. I remember the lady who had lost her legs through diabetes. I was on an acute surgical ward. I remember talking to her as I was carrying out her care. I remember how she made me feel. And I remember how at the end of my shift as the nurse in charge, she gave me feedback on how I'd made her feel. So she's one of my guiding stars, that always put the person at the heart of what you do, and I have goosebumps remembering that. Absolutely. So there's people like that. Actually, in terms of leaders, some standout moments for me has been working with some truly great leaders, and actually, sadly, because leadership is a continuum, so not so great leaders. So there's been some defining moments of some not so great leadership behaviours, obviously of which I'm not going to name on here, but I guess seeing how not to lead, the standout moments of being shouted at in the middle of a corridor, of seeing other people being disrespected or bullied or what have you. There's some standout moments that help shape how then I knew I wanted to do things differently. And then there are standout moments of people like Cicely Saunders, having the privilege of sitting in on a ward round with her, watching her communication skills with the family, imparting the hardest of news in terms of somebody's prognosis and what have you. And actually at that time as well, one of the other people I would say a real inspirational leader for me in my career was Dame Barbara Monroe. She was a social worker when I was a staff nurse, and her skills as a social worker, those are so many standout moments in terms of what I learned from her, including permission if you'd had a really bad day and a really difficult maybe family meeting, or someone had died and a lot of distress within the family, and it's okay. As long as you're not leading your colleagues in the lurch, it's okay to go and get an ice cream and look after yourself. That sort of oxygen mask. So some real standout moments of nuggets of how to do self-care alongside, being the best you can be and delivering what, obviously not leaving people in the lurch, but that permission to go and do something slightly naughty. So I guess standout moments in terms of people, and there's many more. I don't know how many you want me to name, but I hope that's helpful to give you an idea. For me, it's not particular incidents, it's standout people that are related to an incident. Does that make sense?
No, absolutely, because people are organisations, and it's how they actually choose to manage a situation. I often say myself, it's not what life throws at you, it's how you choose to deal with it. And when you've got great role models who've done it so well, it's brilliant, isn't it? So kind of winding back a little bit, what was it that drew you to the health service in the first place?
Well, I grew up in an environment of hospitality, so my parents were both publicans. But my mum always said to me, if she hadn't have been a publican, then she would have gone into care, either nursing or social care. She always said, and actually, to be honest, the sort of way she ran her pub and the way she looked after some of her elderly, vulnerable people who used her pub, I think she was very much of later years a sort of, social services, but from a different perspective. So I think probably instilled in me that care and nurturing for others, probably in that family environment. And I, as at school when I was studying, I knew I always wanted to do something in healthcare, and so that was I never particularly wanted to teach or do other things, although obviously I went into teaching in academia, but as I was going into sort of primary or secondary education, no, it was always for me, I want to go into healthcare. And some of your listeners might find this funny, because I'm pretty much a rule follower, but when it came to having to take a subject at school that I really didn't want to take, so I had to take woodwork, metalwork, needlework, or domestic science, as was then, or there was 4 or 5 of them, or art. Needlework wouldn't have me, metalwork wouldn't have me, woodwork wouldn't have me. Read into that what you will, listeners. But let's just say those practical skills weren't my forte. And domestic science, they gave me a place because I was one of the students who was sort of able to cope with the sort of the science side of it, not just the cookery. But I knew there was limited places, so I didn't want to take a place for someone who really wanted to do it because maybe that was a career option for them, etc. So they said, we're going to have to do art. And I said, I don't want to do art. And they're going to have to do art. And my teacher at the time for my O-level years realised I so didn't want to be there. And we tried discussing it, but there was no going back. It had to be. I had to do something to be a well-rounded individual. So my teacher gave me permission and we got consent and the necessary safeguardings from parental and the care home. I went to be a carer in a care home during my art lessons. Now there's a standout moment of someone who allowed someone to be themselves. And then I thought, this is really what, so that was at age, 15, that then helped determine and shape my career choices, to then go on to university and study to be a nurse, and get my PhD. So yeah, shout out to that art teacher.
Special person. Yes, absolutely. So do you think women lead differently from men, or do you just think it's a bit of a smokescreen?
Oh, that's a really interesting question. I would say that I don't know the evidence base for this. So this is unevidence-based. Jayne's hunch is that there isn't a difference between men and women, a gender-specific difference, because actually there's a continuum of great leadership to really poor leadership, and I have seen both in men and women. So going on my personal experience, etc., actually I think there's just a continuum, and I don't think gender, because I've seen some great male leaders, some not so great male leaders, and vice versa. So I would say it's the characteristics of the individual that are that they're bringing to that leadership, not their gender. And then maybe it's gender stereotypes that we're talking about in terms of does one or another make a difference. But I don't know whether you've got a poll now from all the women in leadership roles that you've been interviewing, Linda, and whether you've now got an answer for whether people where we sit. Do you? I'm not sure if I'm allowed to ask you a question, but I'm going to.
No, it's interesting. The majority have said it doesn't make any difference. One or two who've been in very specific roles have said yes, it does. So yes, it's absolutely fascinating. And one of the things that people also raise is how to deal with difficult situations. And so I've been asking people if they can share something around a difficult situation that they had to manage and how, what they learned from that. So without having to name names, if you could find a situation, that would be really helpful.
Yeah, I think a number of occasions, having been in management and leadership for many, many years, and I can think back to some very early management positions where I was in that position, and that's around managing poor performance and managing sort of challenging behaviours. And I think having the courage to address that and thinking about the way through that and to do it with compassion, but to do it, because if you ignore those things, then that doesn't help the individual concerned, and it certainly doesn't help the organisation. But it's how you do it with compassion, and you do it with appropriate support from other professionals like HR professionals, etc. But that's really important. And I guess probably some of those incidents, including some when I was clinical, were tough. They were tough because sometimes the easier option is to turn a blind eye or not do. But clearly, as a responsible, authentic manager and leader, you need to grasp that those particular nettles, but to do so with due care and attention, both for the individual and the organisation.
Do you think it's ever been as bad as you thought it would be when you started off with some of those conversations?
No, ultimately probably not, because I think what's really important is you remember the why you're doing it. So what's that true north, what's that bigger picture? So I think if you're if you find yourself in a position where you feel you need to take action, is you get the appropriate support, make sure that you're using the appropriate policies to support, and that you're being compassionate, firm but fair, etc. And I think that's the really important bit is, and if I think back, particularly in the early days of my leadership journey, then I was more cautious, but I still did it because I knew it was the right thing to do. And so I think that's, if you've got that, going back to that very early question about, about what your guiding star is, your true north, and, that integrity, authenticity. But and one word I haven't mentioned yet, and I would like to mention, because for me, I guess if you say, could you sum up your leadership? Maybe if you needed to push me on one word, it wouldn't be situational. It'd be a compassionate leader, because I think leading with compassion and authenticity go hand in hand, and I think that's what helps to create cultures of teams who can thrive and perform brilliantly.
Yeah, and I think that's something that's often overlooked in people's concern to deliver. They forget to be compassionate in the process, don't they? So you mentioned about going out, getting an ice cream and looking after yourself. How do you ensure that you maintain some balance in your life, and what kind of nurtures you and keeps you sane?
Yeah, always a great question. Sometimes I haven't always delivered on that, and I've ended up very poorly because of that, in terms of burnout and stress and mental ill health. So I think that work-life balance is really, really important. So for me, really important is, first off and foremost, my wife and my family, my children, my dogs, my cat, and nature. I'm very blessed to live in a part of the country which has very beautiful nature, and so that sort of walking, being out, tending to the garden, the roses, stopping to smell the roses. I make myself chuckle every day, because when I go out to do a bit of deadheading or just to walk around the garden and be in the garden, it's like, yeah, Jayne, you're stopping to smell the roses. Because when I get too absorbed and too subsumed by deadlines and work, then what happens is I stop and don't make time for that, don't make time for my health and well-being, and that's when my mental health starts really suffering, and I can get really quite poorly, and you know, the fatigue, the accepting invitation after invitation, and ending up working, you know, 60, 70, 80-hour weeks, something you learn by experience, but sadly you don't always learn just once. So but really, really important to have that balance. And within that as well, really important for me is mindfulness and meditation. My spiritual practice is really important as well, because it just helps with that grounding and gratitude. I think really trying to remember to be grateful for everything that I've got in life. And it doesn't take much to look around the world to realise actually I have so much to be grateful for. And that will help with that balance of, I've got that meeting, I've got that prep to do, I've got that report waiting, I've got that set of emails, you know, let's just stop and be grateful for a moment that, you know, all the things I can be, and just have a mindful moment, trying to intersperse.
Yes, and I think interestingly, this conversation came up in a program we started last week, where people were saying, I don't have 5 minutes in the morning to just sit or walk around the garden. So we spend a lot of time unpicking what that meant, because you save a lot of time by being well and being able to focus. And if it only takes 5 or 10 minutes a day, you know, it's well worth it, isn't it? And you know, it's interesting how many people think they can't give themselves that luxury. So that's great to hear. So what would you like to be remembered for when you retire?
Oh, well, given I'm, you know, approaching 60 soon, and need to be thinking about what next over the next few years, what would I like to be remembered for work-wise? How I made people feel, making a difference in how I made people feel, how I left them feeling after an interaction, after working with me, after a particular intervention, if it was a care intervention, how I made people feel. And I hope that's good, or certainly, you know, a positive experience of how I made them feel. Yeah, that feels really important to me. Not she worked hard.
Yes, that is so powerful. So what would be a key piece of advice to give to somebody who's embarking on a career in the NHS right now?
Oh, that's a nice question. What advice would I give? I think I'd give the advice of be true to yourself. So going back to that authenticity, be compassionate, be authentic, and find good mentors. And you're never too old and never too senior to have a good mentor. So I still have mentors you know, at my age and my stage of my career, and they're as vital as they were when I was in my 20s, 30s, 40s, 50s. So find a good mentor, be authentic, and look after yourself. Oxygen mask first, and then you can help look after others.
Absolutely. That was absolutely brilliant. So Dr. Jayne Chidgey-Clark, thank you so much for your time today. That was excellent.
Thank you for having me. I've really enjoyed our conversation, and I hope it's helpful, glimmers of something for others. And yeah, thank you.
Thank you.